Namaste. This is Dr. Indira Kedlaya from Dr. Fitness, and I welcome you all to our second Q&A session that we have on this channel. So I'm sure that you will all find this topic very interesting today. So one of the main reasons we all exercise is to keep our heart healthy. Of course, as you all know, exercise has many other benefits. It even helps us sleep better, helps our depression. For older people, it helps them not fall down as frequently, improves their balance, several other things. So we decided to have this talk about heart health and fitness today, and I'm sure our viewers will have plenty of interesting take-home things from this talk today. So I'm very privileged to have with me Dr. Naveen Chandra today, who's a very eminent cardiologist. Dr. Naveen Chandra did his MBBS from Kim's Hospital in Bangalore. He then went on to do his MD in General Internal Medicine in KMC Manipal Hospital in Manipal University, and then he went to Kolkata to do his DM in cardiology. So throughout his education, he's won numerous awards and prizes, and he's had a very distinguished career. He's had numerous publications nationally and internationally, and currently he's working as an intervention cardiologist in Manipal Hospital, Vartur in Bangalore, which used to be part of Columbia Asia Hospitals until very recently. So he's a practicing intervention cardiologist there and a senior consultant. Dr. Naveen Chandra also has learned Bengali. He knows several languages, and Bengali is one of them. He's also an avid runner. He's run several half marathons and marathons, so fitness is really a passion for him. So I couldn't think of anyone better than him to come on our talk today and talk to us about several things related to the heart and fitness. So he's also very passionate about primary prevention of cardiovascular disease. So I thought that was very awesome. And welcome, Dr. Naveen Chandra, to Dr. Fitness. So what are the benefits of exercise to the heart?
Okay, first of all, thanks for having me. And I think exercise, let me put aside certain doubts about exercise. In recently, we've been seeing a lot of reports regarding exercise, death, exercise, heart diseases, whether it triggers and all this. But there are numerous evidences and scientifically proven beyond any smallest of doubt that exercise helps in preventing cardiovascular disease, and its benefits are immense, and there is no doubt about it, first of all. Now, how does exercise help to prevent heart disease? When I mean heart disease, we're talking about heart attacks, blocks in the heart, in a general terminology. Now, exercise can help in heart in direct and indirect ways. Directly, it helps improving the efficiency of the heart, overall reducing the heart rate, developing collaterals over the heart. A person who exercises a lot, who has a good cardiovascular stamina, basically even if he has a heart disease, he actually tolerates it much better than a person who doesn't exercise. So these are certain direct benefits of people who exercise. There are indirect benefits, like there are risk factors for heart disease like diabetes, hypertension, dyslipidemia. These are very important risk factors for heart diseases. Now, exercise is one of the most important ways to control all these risk factors like diabetes, hypertension, cholesterol, weight, etc. So the benefit of exercise in cardiovascular prevention is multiple. Actually, it can directly, it can be indirect. But more than that, the psychosocial or a psychological impact of exercise is what people give a least importance to. But exercise does a lot for them. You can sleep better, as you said. It's one of the best treatment for depression. It elevates your mood. You go for a small walk or a run and come, actually you feel much better. That is something which are not at all talked about. I think that is one of the major, I feel it also contributes a lot in long-term prevention of heart diseases. I think it's direct and indirect, diabetes, hypertension, all those things people talk about, the psychosocial, psychological impact of heart disease, the exercise has on it, and indirectly in preventing heart diseases is something which we give least importance. So I think this is another very important aspect of exercise, not only on heart and on general health also. So Benefits are multiple in multiple pathways, not only for cardiovascular, in every other organ. I think exercise has numerous benefits.
So, how prevalent is heart disease in India? Is it more prevalent than in the Western world? And if so, what could be some of the reasons?
Yeah, definitely. I think there is no question that Indians are in India we have a higher prevalence of heart diseases compared to Western. See, data is not very strong from India, but on an average we would say around there are certain data which says that around 10 to 15% is a prevalence in India.
Okay.
In an urban population, in the rural maybe around 5 to 10%. It's a very rough estimate. There are some studies in Kerala which shows around 18% prevalence, which is pretty high. If you see in diabetics, it will be around 20-24%. In non-diabetics, around 10-12%, 13%, something like that. So generally, if you see a prevalence is much higher than compared to Western population. Not only in India, I think Southeast Asian population are a little more prone for developing heart disease compared to other ethnic groups. Recently, I did an angioplasty for a person in 20s, so I think 30s, 20s doesn't surprise us anymore. It's definitely much earlier onset heart disease compared to Western population, much severe diseases, much diffuse diseases, what we call. Normally, an Indian ethnic group may have much higher number of stents compared to a Western population, or chances of a person going for a CABG is much higher. So I think it's not only the disease is more prevalent, it's much more diffuse, much more severe, and much more earlier compared to a Western population. At least you would say a decade earlier, I would say.
Okay. Is it just because of the prevalence of comorbidities that's present at a higher level, like diabetes in India, or what could be some of the reasons?
One of the reasons for higher incidence of heart problems in India is definitely comorbidities. If you see diabetes, India is the world's capital of world's diabetes capital. So I think incidence of diabetes is pretty high, and also early onset diabetes is pretty common. So I think that is one of the major reasons why heart diseases are much more prevalent in India compared to Western population. Also, other risk factors are also pretty common. I mean, hypertension, metabolic disease, what we call, where is a mixed. It is not a. It is a very unique kind of a lipid abnormality, which is more commonly seen in Indian ethnic people. That is also another very important cause. That not only that, I think if you see fat deposition in Indians also, it's more of an abdominal fat deposition, which is actually not a very great. It's a metabolically much bad fat, what we call. So that also increases the incidence of dyslipidemia, heart diseases. I wouldn't say only the comorbidities. I think ethnically, genetically also, we are more prone for developing heart diseases compared to any other in comparison to our Western population. I think that those, along with that, I think because of industrialization, urbanization, I think food habits are changing. A lot of calorie intake, what we Indians are doing, lack of physical activity, these are also contributing. We cannot discount the fact that we are our lifestyle has taken bad taken a toll compared to our elder generation. Actually, they compared to them, we are eating much. Our eating habits are worsened. Our exercise is reduced. So I think all these things are contributed. It's not one factor, I would say. Of course, we are prone for developing heart disease, but there are cumulative basket of risk factors and basket of reasons which has causing to a higher incidence of heart diseases. That makes us it's more or less more important for us to follow lifestyle guidelines, exercise and diet, etc. much earlier than other populations, I would say. So I think these are the few reasons I would say why heart diseases are much more common in Indian population.
Yeah. So. And frequently what I see in my practice is that people normally think that, I'm very lean, I'm very thin, I don't need to exercise, but then we have what we call thin obese in India because we have a lot of abdominal fat deposition and we have central obesity, as they call it. Yes. And people don't identify that, and exercise really helps in abdominal obesity, which itself is a hallmark or can be a risk factor for cardiovascular disease in our population, right? So is it, a lot of patients, a lot of people ask me, and I'm sure they come to you as well, how important is it to have cardiac screening before they start exercising? Should everybody have it? What subset of people should have it? How old should they be when they start screening if it is indicated, and how frequently should they do it?
See, it's a very it's a question which has doesn't have a perfect answer, I would say. The reason why I say is that now there are two types of exercises. When you're talking about it's a moderate intensity, a high intensity exercise. For a moderate intensity exercise, you don't need a thorough screening before. Let's say you want to walk, you want to start cycling, you want to do a brisk walk at home. You don't need a screening unless and until you have symptoms.
Yeah.
You can just start your exercise.
Yeah.
Nothing stops anyone from doing that. The screening process comes to picture when you want to start a much higher intensity exercises. Elite athletes, or if you want to go for a much higher intensity exercise, that is where a role of screening comes. Again, the role of screening also, see, the most common screening test what we do in heart to rule out heart diseases are ECG, echo, and a treadmill test. That's a stress-induced. If you see the sensitivity of these tests, or specificity of these tests in picking up the heart problem, is still pretty low. I mean, you can, in an asymptomatic patient, there's a 50% chance that you would miss any heart problems in a treadmill. So, and you may overestimate a problem in at least 30% of the patients. So it's not a very sensitive test for us to, screen to make it a guideline for everyone. So an app, a lot of people will come in and tell me that, okay, I have a lot of treadmill, I have got an ECG echo done, how do I develop, how, if a person comes in an attack after 3-4 months, they said, I got ECG echo done, why am I having an attack? But that is nothing to do with the heart. I mean, ECG echo can be normal in almost 70 to 80% of the patients who are harboring a heart problem. So even a treadmill can be normal in 50% of the patients. So it's difficult for us to advocate that as a standard test. The next set of tests what we can advocate is a CT angiogram. Now CT angiogram is pretty sensitive in picking up any heart issues. Now again, there is a radiation in picture, there is contrast UV, although it is non-invasive test, but it still has some risk of radiation, etc., etc. But can we advocate this to a complete general population for a screening purpose? No, there is no scientific body or scientific, any association, heart-related associations do recommend this as a screening test for everyone before starting an exercise. Of course, it can be used as a screening tool for subgroup of patients, especially. See, if you consider American Heart Association, I think they advocate to a person who wants to do a high-intensity exercise to get a stress test at the age of 45 in men and 55 in women. Again, the indication is what we call as class 2, which is not a strong indication. So, there is no hard and fast guidelines anybody has given us. So, what we say is that if the patient has symptoms, any inflammation, any breathlessness, chest pain, palpitations, strong risk factors. The strongest of all is actually family history of heart disease, especially in the 40s, 50s. Somebody in the family has heart diseases. Then those are the people who are the highest risk of developing heart disease. So those people, diabetics, early onset diabetics, and any other multiple risk factors if they have, those are the patients when they start doing a high intensity exercises. We advocate you can go for a treadmill or an echocardiogram before you start any exercise regimen. In a very select subgroup of patients, let's say a person have a very strong family history of heart diseases, very high cholesterol, plus minus symptoms. In such individuals, we can advocate a CT angiogram. Actually, it is indicated for such patients to rule out a disease, low risk patients. So it is always individualized. I wouldn't put that everybody should get or something. It's more of individualized, based on a person-to-person risk profile, I would say. But having said that, anybody after the age of 40, 45, we do advocate everybody to get a health check. But again, the age of health check differs from different countries actually. In India, I think Indian ethnic population, we say 20 to 25 should start getting screening for sugars, cholesterol, and blood pressure every year. I think that is very important. Stress test, echocardiogram, and all those things. After the age of 40, of course, we do every once in a year. But again, what we have to understand is that these tests doesn't completely pick up all the issues. So, so if you're going to start high intensity exercise, yes, of course, screening test can be used. But if you're doing a moderate intensity exercise, I think you can really start off without anything. You know, there is nothing we sort. We advocate moderate intensity exercise for everyone, and I don't think everyone in such a large population can go for a screening test and do anything. I think high intensity, of course, yes. In select subgroup, we should do some screening before.
So high-risk people sometimes, without putting their symptoms into perspective, if they just have a normal ECG and echo, it's kind of falsely reassuring
Yes.
to them, and that's
Yes.
not,
So that's very important actually. It is not at all guaranteed that you're.
And frequently what happens is people on their own get blood tests, on their own get ECG and echo, and they see if everything is within the normal range. They reassure themselves and a lot of times people haven't even visited a doctor. They haven't had a basic test such as a blood pressure measurement, which is one of the most important things. And they haven't realized that they've had hypertensive heart disease all this time and end up missing some things.
And also, a lot of patients, we see that they've done a cholesterol. They think they see the reference values and they say it is normal. Actually, reference values differ from patient to patient, profile to profile. So I don't think when you do a test, if you find some red flags, or if you don't find red flags, it's better to see someone to get the right treatment.
And get the proper advice.
Yeah. Especially in Indians, I think we need to start very early these kind of risk factor management.
What should be the intensity of exercise for your heart health? Now, recently we've had numerous famous personalities in India who have passed away from cardiovascular disease, who apparently were into fitness. They were doing a lot of heavy strength training and very intensive cardio, and they still had cardiovascular disease. So what is your advice to our viewers about that? How much should one push himself or herself to exercise?
See, it's a very controversial topic. I do have some view on this. See, moderate intensity, as I said before, you can just go and do an exercise. Moderate intensity, just walking at the pace of around 2.5, 3 kilometers in half an hour, I would say around 5 kilometers per hour. 10 miles, less than 10 miles of cycling is called a moderate intensity. If you want to play tennis, doubles is a moderate intensity. Light dancing is also a moderate intensity. These are moderate intensity exercises. What do you mean by moderate intensity is that when you do that exercise, you should be able to have a conversation with your person who is next to you. If you can have if not a comfortable conversation, a good conversation with him, it means that it is a moderate intensity exercise. Now, moderate intensity exercise, scientifically we say if you're pushing your target heart rate to around 80%, less than 60 to 80%, it's called moderate intensity exercise. But of course, everybody cannot, like look into the heart rate and do exercise. So, if you're comfortable while doing exercise, you can have a conversation with your vice chancellor. That means you're doing an moderate intensity exercise. That is okay. What we advocate is around 30 minutes a day, at least 3 to 5 to 7 sessions, 5 6 sessions per week, which accounts for around 150 minutes. Now, what do you mean by high intensity? High intensity is where you won't be able to have any conversation with the person next to you. So you will be able to just take breath. So it's anything running, swimming, singles tennis, or if you're doing a cycling of more than 10 miles per hour. These are high intensity exercises. Now, there lies the controversies. High intensity exercises should we do? There are so many incidences which occur. See, if you see historical data, but I think these are just statistical numbers. Of course, any heart disease if you take, if you're doing some activity, there is a higher risk of you developing heart disease. There is a 2-fold or 3-fold increase in heart attacks when you are doing some activity, which may be walking, talking, sleeping, eating, exercise, whatever it is. So
the cardiac requirement goes up.
It goes up. So it is a natural. It's most likely occurs during an exercise or an exertion.
Yeah.
Now, if you see, if you let us say a marathon runners, there have been studies which has shown that they have done a pooling of data in the US where there were the 4 lakh marathon runners over a period of 10 to 15 years. They pooled in the data and they saw that there was a 39 events, 39 sudden cardiac deaths. Okay. Now 39 events out of 4 lakh people, and in that some are heat stroke accidents also. It's not only cardiac deaths which are there. They also pulled in the incidences of heart diseases. In a runner, or a general sports, you would say around 20 to 25 in a million per year. If you see an elite athlete doing that, it will be around 10. I mean, actually the number halves for a million per year. If you see general population, how much is the incidence? It's around 400 to 500 per million per year. So statistically, the numbers are still low.
Absolutely.
But if the events which occur in these kind of exercise get a more news garners. Lot more people die while sleeping. Lot more people die while not doing an exercise also. So that the people who does an exercise which gathers much more attention than people who have an event, it can occur in any time. I mean, it is more likely that a person will have an event when you're not doing an exercise than doing an exercise. But unfortunately, this is what in the statistics, it's such a large country, always statistics cancer. I don't say that this doesn't cause an MI. There is definite scientific evidences that if you're doing a high intensity exercises, you can have an event. Now there are different reasons for it. Now who are prone for this are who has risk factors. Now if you have a strong family history, you're a diabetic, you're hypertensive, you have high cholesterol, you have multiple problems, you had an angioplasty in the past, you have not never got any cardiac screening done, of course you are going to have a high risk of developing heart diseases in such patients. Now second is that the way you train also matters. Now if you see most of these events, it occurs in the initial part of the exercise and mostly in amateurs. If you divide these data again, in elite, well-trained athletes is pretty low, still very, very low compared to people who just started. Let's say I do some walking and next day morning I get up and say I will run a marathon. It doesn't happen like that. So you tend to going to have some problems. So if you structure your program of any exercise, if you're doing a high intensity exercise, pace yourself well, train yourself well, make your body accompany, you accompany your body across the journey of that, the training, then it is very less likely to have any event. So I'm not discounting the fact that it may lead to an event, but the incidences are very, very less compared to it is been shown, even in a high intensity exercise. Of course, for a cardiovascular benefit, if you want a benefit for your heart, its moderate intensity is more than sufficient. I don't advocate that you need to do a high intensity exercise to get benefit for your heart. Moderate intensity is more than sufficient. It's always a U-shaped curve. When you do moderate intensity, you get immense benefit. From there, if you make it to a high intensity exercise, you're not going to get an incremental benefit. You may get a 5-10% benefit, but you may not get that kind of a high benefit when you increase the intensity of exercise. So even a moderate intensity exercise is more than sufficient to get a walk, a brisk walk, 30 to 40 minutes a day, make it around 150 to 200 minutes a week is more than sufficient to have a good cardiovascular health. But if you want to do a high intensity elite, you want to run a marathon, you want to do a cycling of 100 kilometers, you have to make sure that you train yourself well. Rather than suddenly increasing your activity, you let your heart rate go 100-120% more than your target heart rate suddenly, and those are the things which people get into trouble. But if you are also screened, if you are doing that and if you have a strong risk factor, strong family history of heart disease, then of course you have to get a screening test and then start training yourself for it. So this is how I would put in this, that it garners much more a higher media attention if you run and die rather than if you don't run and die or don't do exercise and die. It's unfortunate, but that should not deter us from, the problem is that people have losing faith on exercise because of all these things, which is not right, I'd say. I think moderate intensity exercise or walk or I don't think anything to fear. And it is if you don't do anything, the likelihood of you dying or having a heart problem is much higher than doing something.
However, sometimes if you are a young person with a lot of risk factors, moderate intensity exercises may be good for the heart. by itself, but it may not be enough to reduce your comorbidities. For example, if you have very badly controlled diabetes, you of course need your dietary guidelines. You may need weight loss. You may need a little bit more higher intensity exercises to lose that weight and get your sugars under control.
Absolutely.
So yes.
If you want to lose weight, just a moderate intensity exercise wouldn't do that. You may have to push yourself a little more.
It all depends on what your fitness goals are.
Absolutely,
basically.
yeah, absolutely. I think there are other high intensity exercises. There are studies to show that they have done a long-term study about marathon runners. They live a little longer and they have a higher VQ ratio and their immunity levels are much better. There are other advantages of doing high intensity exercises as well. I think it's a more of an individualized goal. I think everything has its own benefits. I think, but it's an unwarranted attention, I would say. I think people should know the facts and train themselves well. I think they should go.
Also, there are a lot of benefits to doing what we call HIIT exercises or HIIT, high intensity interval training, because you do get peaks and valleys.
Absolutely.
That way you're able to take some rest. Yes. And the other problem is that I see that a lot of young people who exercise now are mostly exercising to achieve a certain body type or muscle building, so-called. They're not exactly exercising for their health, and that I think needs to be highlighted as well.
Absolutely.
So for people with pre-existing cardiac disease, for example, somebody has survived a cardiac arrest or they've had significant blockages requiring, of course, even things like angioplasty or CABG or bypass surgery, should they exercise? Or can they exercise?
Yeah, they have to.
Yes.
The simple and plain answer is they have to. These patients who has already cardiac diseases are very important for them to continue to exercise, or if they are not doing, they have to start doing exercise. There are important reasons for it. One is, of course, the benefit of exercise, which we were discussing in the previous questions. It helps in controlling their sugars, hypertension, diabetes, all those things. That's one part of it. Second is there are earlier symptoms of heart-related issues can be picked up during exercise. Now we always sensitize the patient when they're going home. Once you have a heart problem, which may require angioplasty, bypass, or it doesn't make you invincible. It makes you more prone for developing further heart-related issues. If you put a stent, there is a chance that the 1% chance of a person having a stent blockages again. If you have a bypass, even 5 to 10 years down the line, people usually tend to develop newer blocks or the grafts getting closed. So these things are possible. So they have to keep looking for the symptoms. One easiest way of looking for symptoms is your symptoms during exercise. That is one important reason why we ask them to continue doing the exercise. Let me give you a simple example. Let's say a person is walking for around 30 minutes. If he is unable to walk for 10-15 minutes, he feels tired, that is one of the important signals for us to go and look into his heart again, what has happened. Even they may not have the classical chest pain or something like that. Even these are indications of person who is developing a repeat blockages or repeat heart diseases. So it is very important for them to look for symptoms. So for that, they need to exercise. They need to have some level of activity every day.
Like establishing a baseline?
Yes, absolutely. Very true. They have to have a baseline which may be 40 minutes, 30 minutes, whichever their body allows them to. And then you keep looking at your symptoms. A lot of patients, a few years down the line, they come back. Recently, I had one patient who had an angioplasty done 4 or 5 years back. He started developing, just couldn't walk. There is no other symptoms. He just couldn't complete 2 rounds, which he used to complete very easily before. We did an angiogram, we saw there was a new block in his heart. We had to fix it up. If he had not picked it up, probably he would have ended up in an attack after a few weeks. So this is another very important reason why they should keep exercising, to pick up symptoms, and also, of course, it has its own value in reducing the risk of diabetes, hypertension, weight, maintaining the weight. All these things are extremely important. And but another very important thing in such people is that to structure it well. I mean, of course, for them also we say around 150 to 200 minutes per week is good enough. But we have to structure the rehabilitation well. It may not be a blanket statement for everyone. It may vary from person to person depending on his heart problems. generally 90% of the patients should be okay, and there is nothing like a bed rest after an angioplasty or bypass. That's a very wrong conception. You have an angioplasty, they say you have to have a bed rest. No, they should. We make them walk from the second day itself. They have to walk from the second day. Of course, we have usually increased it by 5 to 10%. We increase the intensity and distance every week to attain the normalcy by 4 to 6 weeks. So, but if you have a person has a heart failure or a lot of fluid accumulation in the lungs, we may have to go slow. We may have to structure his rehab in a way that we don't push himself a lot. These are the patients. They cannot. Their body will allow them to do some things, and they cannot push when they have symptoms. They need to stop. They have to escalate it very slowly. They have to pace themselves very slowly. By 4 to 6 weeks, most of the people will get back to their original effort tolerance. Some people may not get back there, but exercising and slowly increasing their stamina is the only way to get there. So that's very, very important to structure yourself, structure your rehabilitation program so that you attain that kind of effort tolerance, what we call. Then people say that there is another misconception that we cannot go back to that original exercise effort, or you can't walk, you can't do that. That's all. It's all false. I have had patients post angioplasty have run marathon. They've gone into a very high intensity treks. Yeah. It's possible. They have to, of course, do some tests and make sure that they are all right before doing all those things. But it is possible to attain that kind of an activity. But they have to, at least do a moderate intensity exercises. But in a specific subgroup, they want to go a little high intensity. We can, after doing certain tests, we have to. But baseline exercise is a must, irrespective of whatever disease they have. They have to continue to do that.
Yes, yes. We are in a pandemic right now, and we've seen a lot of cardiovascular diseases, cardiovascular deaths, strokes, heart attacks, and some clotting disorders after getting a COVID-19 infection, especially during the first and second waves in our country. Maybe not so much after the third wave recently. So, what advice do you have for patients who have risk factors or who had moderate COVID-19? What advice do you have for them?
Yeah, there is definitely an increased incidence of heart diseases. Of course, in the last third wave, we haven't seen so much. First and second wave, especially second wave, we used to see a lot of heart attacks, cardiovascular diseases, etc. Again, see what the exercise, and coming back to your exercise regimen, again is a very controversial issue post-COVID. We all have to remember that COVID-19 is not a simple flu virus. It is much more complex than a flu virus. It involves endothelium, it involves not only the respiratory tract, it involves multiple organs. So people with COVID-19 have a higher incidence of heart disease because of all these reasons, the virus, and there is an increased coagulability of the blood, etc. There are multiple reasons, I wouldn't go there. But when you restart your exercise, always I think that it has to be again paced very well. We say 4 to 6 weeks you have to go slow. Because of the involvement of heart, there are studies to show that even with the patients who are asymptomatic or mild diseases, there are heart involvement. They have done an MRI to see that there is some amount of heart involvement. You see these people with post-COVID, there are a lot of people come back with breathlessness, tiredness, palpitations, very common. A lot of people have palpitations. They are unable to walk so much. They feel very tired, which actually persists for a few weeks, sometimes months also. These are called long haulers actually, and it's pretty common. But fortunately, third wave hasn't had so much of long haulers compared to the number of cases we had. Second wave had a number of long haulers actually. So these usually are self-limiting symptoms, but this causes a lot of discomfort to the patient, and that doesn't allow the patient to restart their exercise regimen. If you ask a lot of patients, I have not started because I feel tired, I don't feel like I have a lot of palpitation, and they don't start, and it becomes worse actually. Another thing you have to remember, if you are into exercise, you don't exercise for 1 week, your actual tolerance comes down by more than 20-30%. Even an elite athlete, if they don't exercise for a month, they are down by 70-80%, they are down. So at the age, after the age of 30-40, your muscle memories become so poor, and your deconditioning of the body is so rapid. So if you have an infection, there is 100% there will be a deconditioning of your body. You don't exercise for few weeks, you're not nutrition is also takes a hit. So your body is again deconditioning. On that there is this kind of viral infection which should run further. So all these factors contribute for this issues along with some mild heart involvement, cardiac muscle involvement. Now this doesn't that makes you difficult. That makes a lot more difficulty in walking, palpitations, etc. But they stop doing anything after that, and that actually worsens. It's a vicious cycle. You want to break the cycle.
Yeah.
Now, breaking the cycle is only by exercising.
Yes.
That's an unfortunate thing. Of course, you have to go slow again. You start, walk for 5 minutes, sit,
Yes.
go for another 5 minutes. Don't push yourself. Take rests in between, and use every day, every week. You increase the pace, and you will get back there in 4 to 6 weeks. And most of the patients will get, even with the worst, very bad lung infection, a few months down the line, people are all right. But if you stop, it is just going to go worse and worse. So activity is very important. Hydrate yourself well. Take multiple intervals. If you are doing half an hour exercise, maybe you divide it by 15 minutes, or every 5 minutes you take rest and do it. And over a period of 1 or 2 months, you will get back. So I think pacing yourself well, structuring your program, exercise program, and also taking rest in between, good hydration, good nutrition, that is very important. And give yourself body some time. It's not like a normal flu, you can just go and start running next day. You got to be careful. Most of the people, nothing happens, even a slightest chance of some event occurring in such time. I think we have to be careful. I think this is how post-COVID, I think we should take care of our body, because it's a big problem. I mean, the number of patients who got infected now is so much that, especially people who are doing high-intensity exercises post-COVID, I think they have to go slow, take a break for a week or so, start with moderate intensity, and but most of the time you can go back to what you were. You just need to give them some time and let the body heal. And we have seen in second wave, everybody, most 99% of the patients have gone back to that original state. But yeah, it takes time. But you have to put an effort. Don't stop anywhere. That's important.
Okay, well, thank you, Dr. Naveen, for such
so much,
thorough explanation of all our questions. So basically, the takeaway point is exercise, exercise, exercise. Yes, it's part of being fit, in addition to a healthy lifestyle and eating right and all those things. Just because you exercise doesn't make you invincible, right? So you got to keep other things in mind. You have to control other risk factors. You have to think about your genetic factors. Yes. So there's a lot of other things to think about. Listen to your body while you're exercising, and that is very important. Yes. Thank you, Dr. Naveen. I know you're very busy, and I really appreciate you taking time off to come on our channel and talk to our viewers.
Thanks for having me, and it's a pleasant conversation.
Yeah. Thank you. Thank you. Namaste. Thank you very much for watching our video today. So if you do like our channel, please hit the like button, share with your family and friends, and subscribe as well.